This is an online guide to changes made to the new NDTRS data collection form. In order to comply with EU reporting requirements, the NDTRS form has been extensively changed and updated. As part of this process, the NDTRS team also took the opportunity to revise and update the remaining questions to ensure that data important at a national level are also captured. This learning resource explains the new and revised questions.
Question 2b, Individual Health Identifier, or IHI. The administrative details section of the form has been modified to include a field to capture the individual health identifier in preparation for the future implementation of the IHI. This data field will only be used once the IHI has been rolled out. Question 3a, Sex, and Question 3b, Self-defined sexual orientation. The gender field on the old form has now been replaced by two new fields. The rationale for collection of data on self-defined gender and sexuality comes from specific actions contained in the current National Drug Strategy, or NDS. A key theme that emerged throughout all stages of the consultation process for the NDS was the requirement to focus on the needs of specific communities and help them to access services tailored according to their needs. In addition to the needs of travellers, prisoners, new communities and homeless people, the other key group identified was lesbian, gay, bisexual and transgender, or LGBT people. This new question will provide data to allow actions 28 and 44 of the NDS to be assessed and measured in relation to LGBT people. Remember, this refers to how the person defines their own gender and sexual orientation, regardless of any outward appearance. If the user does identify as transgender, then tick transgender. If they have a preferred sex by which they define themselves, then also circle either 1 male or 2 female. Question 7. Number of children. This is an entirely new field that will allow the number of children that a client has to be recorded, whether they are under or over 18 years of age. This new question will enable information to be collected in 3 age bands: less than 5 years old, 5 to 17 years old, and 18 years and older. It would also allow the living arrangements of the children to be captured for the first time. This means that in the future, the number of children living with problem drug or alcohol users can be enumerated. This will assist with estimating the number of young and older children at risk of hidden harm. Complete these fields as best you can, even if it's not possible to determine the age and living arrangements of every child. In other words, the number of children in the age and living arrangements boxes may not equal the total number of children in the box above.
Question 9a, Education Highest Level Completed to Date. This question has been revised to record the highest level of education completed to date by the service user. In the case of a 15-year-old service user still at school who has not yet completed their junior cert, please select Primary Level for question 9a, Still at School for 9b, and Student for question 10, Employment Status. Question 11a, Country of Birth, 11b, Ethnic Cultural Background, and 11c, Language other than English or Irish at home. These fields replace the nationality and ethnic background on the previous form so that the NDTRS form reflects the ethnicity questions asked by the Central Statistics Office, or CSO. Instead of nationality, country of birth will now be recorded. The terminology for the options on ethnic cultural background have been standardized with the CSO terminology, and the option of Roma has now been added. A new question on the language spoken at home other than English or Irish has been included. Information garnered through these questions should assist with planning services for new communities. If you believe a language other than English or Irish is spoken at home, but are unable to determine what that language is, then circle 99, Not Known. Question 13, Main Reason for Referral. This question has been changed significantly. The options of illicit and licit drugs have been replaced by a single option of drug, and you are asked to specify the drug in the space provided. A new option 3, concerned person, has been added to cater for service users directly affected by someone else's alcohol use or drug taking. If concerned person is specified, the whole form can be completed for these clients, in which case all questions relate to the treatment of the concerned person and not the substance abuser. This is entirely optional as this data does not form part of the NDTRS reporting. Option 4, other problem, includes gambling, spending, eating disorders, sex or porn addiction, as well as internet gaming, which should be specified in the space provided. Remember, the main reason for referral entered here must also be entered as the main drug in question 21 in the drug use section of the form.
Questions 21 to 25, current problem drugs. 4 additional problem drugs can now be recorded instead of 3. This should allow better understanding of trends in polydrug use. Don't forget, the main drug specified here must be the same as the main reason for referral specified in question 13 in the referral assessment details sections of the form. Question 29D, number of previous alcohol detoxes. In order to understand better the harm of problem alcohol abuse, a new question looks to ascertain the number of alcohol detoxes a client has previously undergone. The need for alcohol detoxification can be an indicator of chronic harm caused by problem alcohol use. If the answer to this question is unknown, then enter 99. Question 30C, frequency of injecting. In line with requirements for reporting to Europe, information on the time period during which the client last injected has been expanded to offer 4 possibilities. Only circle one of the options. Question 30D, ever shared needle and syringes, and question 30E, ever shared any other drug paraphernalia. In order to comply with reporting to Europe, the questions on sharing drug equipment have now been separated out. Sharing of needles and syringes is to be reported separately from other drug paraphernalia, such as straws and pipes. The time period for any sharing will also now be recorded. Shared in the past 30 days, shared in the past 12 months but not in the past 30 days, shared but not in the past 12 months. In both cases, select 99 if the answer is unknown.
Question 31, history of viral screening. This is a new question that should be asked of all service users and not just those who have previously injected. Question 32A, treatment interventions. Services will now be able to record the start date, end date, and number of sessions of key working given during a client's treatment. The way detoxification is recorded on the NDTRS form has changed. You can now record the specific drug that the service user is detoxing from. In addition, detox from specific additional drugs can also now be recorded, including Z drugs.
Question 34, at end of treatment or when last seen, client is or has. The exit details of the form have been significantly changed. The revised form will try to capture more meaningful information on the condition, outcomes and progress of clients when they leave the service. Information about changes in drug and/or alcohol use, about progress with their care plan if applicable, and about engagement with other services on the road to recovery can now be collected. There is also an option to specify other outcomes important to different services, which will be monitored over the first year of data collection. Subsequent versions of the form will be updated and revised where possible to reflect important emerging measures. Circle all the options that apply to the client.